Hi, it's Melanie Didham, continuing with our Preceptor development program for the critical care nursing program. And today we are going to talk about critical thinking development. So being a nurse is more than recognition of medical terms, illnesses, and skill development. Critical thinking skills drive the decision-making process and impact the quality of care provided, which directly impacts patient care and outcomes. So, the ability to analyze a situation and come to a solution separates the good nurses from the great ones. Development of critical thinking requires practice in a clinical setting. One cannot do this in a classroom or in simulation. It needs to be a lived experience in the learning environment. That's why effective preceptorship is so important. So with the critical thinking and preceptorship, our goal is to develop and promote critical thinking, and it's the major approach to teaching novice nurses in the clinical setting. So the experience not only prepares learners to become competent, but also promotes and fosters critical thinking ability. So the process. The critical thinking process is the transfer and application of knowledge and skills to a new situation. It begins with an open-minded assessment. It formulates a working hypothesis supported by data, and review previously acquired knowledge and skills of similar application. And the ability to apply these knowledge and skills to resolve problems, and where gaps in knowledge skills are, you seek out required information. And then you always evaluate the outcome. Was it appropriate, accurate, complete? And then you reflect to see what, if anything, could have changed. So you don't know what you don't know until you're forced into a situation requiring these missing gaps in knowledge. So some barriers to critical thinking. Some personal barriers could be someone being closed-minded and not open to new evidence. So that's the my way is better and choosing only one way of doing something. And this face-saving resistance to change and conformity is the way that we have always done it. So if it's not broken, don't fix it, which doesn't always follow evidence-based practice. Stereotyping is labeling someone as different, therefore you disregard what they say. And this self-deception, we mean someone who thinks that they're the experts, so they are always right. They can never, ever be wrong. So those are all barriers to critical thinking. Some characteristics of critical thinkers are critical thinkers believe in well-reasoned thinking, and that this will lead to trustworthy conclusions. So critical thinking is rational and reasonable. It involves conceptualization. It does require reflection. It involves cognitive thinking and attitudes. And it involves creative thinking as well, and also requires knowledge. So a nurse gains greater awareness of this thinking process, and more experience improves such thinking, and the confidence will grow as a result of this. Such a nurse can serve as a role model to colleagues, inspiring and encouraging them to critically think as well. Nurses are the healthcare professionals who spend the most time with patients. As a result, the ability to detect changes in a patient's condition, recognize a change in priorities, the ability to adjust your nursing care, and to alert any medical professionals that are required when appropriate is crucial. So some examples requiring critical thinking would be the analysis of your assessment data to determine the major health problems. And as a result of this, you establish the priority of needs for a current situation, and then you evaluate the effectiveness of one's intervention that you recently provided. So, a vital step in developing critical thinking is for novice nurses to learn from those around them who have a strong base of practical experience. And this is in the form of our preceptors and colleagues. So as an open-minded nurse, they can learn valuable lessons from others' critical thinking ability and will be able to practice for the good of their patients. So how do we promote this? So the climate. So the more anxious someone is, the less able they are to think clearly. So the goal would be to have an open, non-threatening, supportive, and accepting environment. Being a role model. Preceptee behavior and thinking are influenced directly by their preceptor. So the goal is to have a clear communicator with consistent behavior who are open to different ways of thinking. How do you guide your preceptee? So you tailor your patient assignments to their learning needs. So the goal of this is to help improve and foster their clinical judgment, and this will enhance their ability to assess and arrive at reasonable and appropriate decisions. Another way is to be a facilitator. So the preceptor paves the way, and the goal of this is to help identify any learning needs, define some specific goals, and assess the achievement of goals and objectives. And this enables the learners to be able to start thinking critically. The prioritizing thing. So what is important? What's normal? What's abnormal? So the goal of prioritizing your care with your patient is to prioritize, review, discuss, and explore the need to know and do now versus the later or nice to do. Because when you're a novice, you don't have the ability to fine-tune what's most important sometimes because everything is important to them. Questioning. So challenging your preceptee's way of thinking is to encourage them to justify or clarify their explanations and their decision making. So the goal of this, it helps them resolve any encountered dilemmas and helps facilitate the development of originality of thought. So it doesn't just become, this is the way they always do it, this is how I was taught. They actually know the reason behind why certain things are done a certain way. The teachable moment. If faulty thinking is left unchecked, novice nurses can be easily misguided and or deliver flawed patient care. So this is definitely something we want to correct and discuss early in the nurse's practice before it becomes a habit. And if you observe or note something that could have been done differently or better, then this is a teachable moment. And if you don't take this opportunity and miss it, you also miss the chance or the ability to correct it. And if you correct behavior or the practice, then you also have the ability to change the novice nurse's belief that they are actually doing something correctly and with, common practice or evidence-based practice. So that's the time to change the behavior, is early before it becomes a habit. So the type and quality of preceptorship can influence whether a learner will adapt a merely reproductive style of thinking versus a deep, holistic strategy of thinking. So preceptors must be willing to role model their critical thinking skills and abilities so that novices can internalize these skills and become more confident in their developing critical thinking skills. So how do you assess their critical thinking? So you want to make sure you have their attention. So you ask them some questions. What would be important to include in the respiratory assessment of this patient, for example? You can question them to see what their rationale is for coming to a certain conclusion. So why would ordering this specific drug at this time be helpful for the patient is a good question that provides the ability to talk about it. So constructive feedback is both positive and negative. So we usually will start with the positive and then go from there because you're starting off at the right foot. So I reviewed your documentation and found the physical assessment was documented concisely and accurately, or something like that. So you find something that they did well first. And then Make sure you give feedback about errors or omissions, such as you were unable to find and analyze rhythm strip with your morning assessment. So that's something that needs to be done, and if it was missed, then it's something that you guys can discuss. Teach a general principle. So one thing that will become routine for you as you work here is checking the ventilator settings hourly. I always tell my preceptees that you have to look at that ventilator every time you do your assessment, every hour, because people sneak in and make changes without telling you sometimes. That's just a good example. And summarize. So clarify any expectations or objectives for the remainder of the shifts or the shift. So you can complete the primary assessment of the patient, do the documentation, and then discuss with your preceptee if there are any things that they would like to see, anything that they want to improve on, or any questions that they may have that you guys can discuss either then or at a later date. So the great thing about finding out where someone's coming from or what they're thinking about is to use open-ended questions. So the development of a novice nurse's critical thinking skills is mandatory, since nursing is a challenging, complex, and culturally diverse hands-on profession that requires astute power of clinical judgment, decision-making, and problem-solving skills in the nursing practice. So using open-ended questions can help you as a preceptor determine the preceptee's thoughts and help foster some critical thinking. And this will also help you as a preceptor, in assessing their progress. So some good intro questions could be, what are your thoughts when something happened? Why do you think this happened? What could we have done differently? And that's a good way to lead into some constructive negative criticism, shall we say. Or say, explain to me how you came to this conclusion, or explain to me how proning a patient might help them out in the long run. Describe for me the steps in triaging this case, or tell me what went well, or what could you improve upon with regards to, say, an assessment of a situation, or communication skills or things like that. And what were some of the clinical decisions that you made? And describe your priorities in this patient. And that might be a good thing to do after the person gets a report, goes in and does their first initial assessment, and then you can plan your day. And that's a good way to say, okay, what's the priorities and what do you think we're going to do today? And that'll allow you to either, guide them into what needs to be done versus what can be done, which would be awesome, versus what needs to be done first. So critical thinking is an essential skill needed for identification of client problems and the implementation of interventions to promote effective outcomes. The process of providing feedback and reflection is vital to the improvement of nursing practice. The insights nurses acquire lead to changes in their approach to practice. So the preceptor's role is crucial in starting off a novice nurse's critical care nursing experience. And this is just a little snippet of how to promote some critical thinking and what tools you can use to help yourself and help your preceptee develop as a critical care nurse. Thank you, and I'll see you with the next slide.